patient was admitted with fever for 5 days. So,
behalf of Umang is a non-judgmental, authentic platform for medicos to share their experiences of doctors, by doctors, and for doctors. It is created by shared vision healthcare providers coming together and expanding their horizons beyond the limitation of professional learning, which led to a different kind of CME, that is creative medical evolution, through various enlightening, encouraging, and engaging by medical professionals across the entire medical spectrum, from students, medical residents, young doctors to senior most doctors, public and both private sectors, doctors from all specialties have been part of this movement in last 3 years. We have a YouTube channel named Umang Empowering Medicos. Please subscribe and share your valuable inputs. So today's host will be Dr. Sharvari Rathod, a clinical associate in chest medicine, Jupiter, and myself, Dr. Divya Rajshekharan, resident in critical care medicine, Jupiter Hospital. So now over to Dr. Sharvari.
Very good evening, everybody. I welcome all the audience and our expert panelists who have joined in today. I'm Dr. Sharvari Rathod, the co-host for today, along with Dr. Divya. I am a clinical associate in the pulmonary medicine department, Jupiter Hospital. And I think I feel extremely privileged to be a part of this conversation today. I feel women are the backbone of our healthcare system and their safety is paramount today. And from facing long hour shifts to working in remote areas, I think the challenges that we face are overwhelming. I think we all have been there and done that. And to joining us today are some incredible experts who will be shedding some light on the women's safety issues. So we have Dr. Soumyata Mishra with us, who is a surgical oncology resident from Mahavir Cancer Sanstha, Patna. We have Dr. Sukanya Sampath, critical care medicine resident from King George Medical University, Lucknow. Dr. Paramita Thande, general surgery resident from RG Kar Medical College, Kolkata. We have Dr. Nilima Vaidya ma'am, gynecologist and medico-legal expert from Mumbai. And we have Dr. Sharmila Sondhi ma'am, who is the vice president and co-founder of Women Association of Otolaryngologists of India. So I welcome you all. And without much further ado, I think the first question I would like to ask Dr. Paramita today. I think today is the day 49 of the protests that we are facing. And how are you actually managing the situation there in Kolkata?
basically, after last Supreme Court hearing, we have decided to resume our essential works only. So we have resumed our essential duties and simultaneously we are also continuing our protest. And today also we are having a mass convention at SSKM Hospital Auditorium. It is still going on, and we have some future plans for the upcoming days. Like we all know, Durga Puja is being celebrated in Bengal widely, but this year we will not be celebrating to that to some higher note. Rather, there is a day called Mahalaya, from which the Durga Puja celebration actually starts. So we have thought of doing something, some rally on that day, and some special activities will be held. Also, we have at present, as per the latest update, we have sent a mail to the Chief Secretary of Bengal, stating our 7 demands regarding our safety and the securities, and we are really looking forward to it. Whatever response come from the government. Also, we are working on the threat culture, eradication of the threat cultures. We have called out the people who were involved in the threat cultures for last few years, and inquiry committees have been set up, and those people are being called up by the inquiry committees, and inquiries are being held. So everything is under processing now.
Okay. So, Dr. Paramita, what are the challenges that you're facing right now, and what is actually keeping the entire medical fraternity over there going?
So the main challenge is basically, first of all, the safety and the security. It's the 49th day after the incident has taken place. Still, no visible action has been taken by the authority except few CCTVs. We still don't know whether those CCTVs are under active surveillance or not. Also, there is no other, as the Honorable Supreme Court has stated that there should be properly trained security personnel appointed at every point of the hospitals. But then no, RGCOR is having CISF posting at present, but for the other hospitals, no other extra security personnel can be seen. No extra safety measures has been taken. And regarding the restrooms and the washrooms, whatever was stated by us, nothing has been done till now. They don't have even initiated a single inch of work. Nothing has been done. So this is, and regarding the task forces, we demanded for a college level task force and a central level task force. The college level task force was there is no task force has been built till date. So we don't find any progress in the like towards our safety and security. And also regarding justice, this is our first demand regarding the justice for Abhaya. So we don't see any visible safe there except for the arrest of our ex-principal Sandeep Ghosh and the OC of the local police station.
Absolutely, Dr. Parimita. I can completely empathize with the situation. And so what is the support that you expect from us, the medical fraternity all across India? What are your inputs on this? And would you like to send across a message on this platform today?
So we'd like to send across a few messages. Number one, please stay with us to seek justice because we know that we feel actually that it's very difficult to get justice in this case because as we feel that maybe some big shots may be involved in this case. And also, secondly, for the safety and the security, I think this is the issue all over the India, not only in Bengal. That's why we all demanded for the enactment of the Central Protection Act. So we think that must be enacted and we should keep pressure on that, pressurizing authorities for enactment. And we should have to work on the enactment, the enforcement of the national task force, the central task force, and the college level task forces. And also, there should be all the committees in every colleges like ICCs or the grievance redressal cells or the any kind of such committees should be activated. Like in Bengal, I can say those committees were there, but those were really not active. Those didn't work. That's why this has taken place here. So these committees should now work actively and in a very unbiased way. And obviously, I don't know about the rest of the India, but in Bengal, threat culture has prevailed a lot, and that has messed up with many lives of the students. So we need to eradicate this. And there was one instances there is a college called Kalyani JNM Medical College, and they have the authority of that college actually suspended 60 people who were held responsible for entertaining this threat culture. And our CM, she has unofficially she has threatened. I should not use this word, but I am very compelled to use this word. She has threatened the principal of that college for taking such step against the people who was entertaining the threat culture. So we really fear that government is not having any significant contribution in eradication of the threat culture.
Can't believe
Yeah,
what
what
you're undergoing.
What kind of threat you people are getting?
Nowadays, we're not getting any significant threat because we have already called out the names and inquiry committees have been set up. But when in the initial days, just after the incident has taken place, like in around 17th, 18th of August, or to 20th of August, giving us threats like then we will take action against you. Even there were students, they have called up the parents of few of us saying that tell your son or tell your not to get involved too much. The picture
Paramita, you can go off video and speak. Your network is in challenge.
Just check your network.
actually the network is not very good here.
Okay.
Yeah, we could hear you, but recently we just lost you towards the end.
So we have got threats, but now we have stopped getting those threats. Really be active now as there and having that. So now we fear that it will not go that long.
Paramita, go off video and speak, please. We're not able to hear you.
Am I audible?
Yeah, now you're audible. Yeah.
Okay.
So last few
Ma'am,
sentences. Yeah.
so yeah, you are not actually getting too many threats now, but we will. If once the situation calms down, then we will again get the threats, start getting threats. The situation scenario will be again. Ma'am, I'm very sorry, I have to go. Actually, I have.
Okay, we understand, Dr. Paramita, you are in middle of an emergency. So thank you for your inputs, and I think we should carry forward. Dr. Divya,
Yeah, yes.
please proceed with the question.
In spite of her on-call day, she has shared her time with us. We'll go on to the next question. What are the unsafe surroundings in our working areas and how to recognize them?
When you are working in casualty or when you are in somewhere, you should say if any person is dying or any serious condition is there, and if a serious patient brought in casualty, it is the first other time we have to be alert, because patient relatives of that kind of patients get aggressive. Other thing is, when you are in like some places where you are finding there is dark light, or in a night duties where you have to come from a very narrow areas that we should avoid. Third, always in the night duties be in the presence of some public place. Don't go in the isolation, because in public place might be you face some difficulty in resting or all, but you will be safe because nobody has any dare to come in the uh, crowded place, and nobody can trouble you. So in short, you should avoid isolated places. In short, you have to avoid dark sides of the hospital corridors, and not to travel in the isolated areas in the night. And in case most surgical patients faces a trauma patient, and critical care patients usually come in the night and they die on the spot. So people are creating some trouble. At that time, you have to be connected with your colleagues and all, so that you can avoid this troublesome situation. That's what I think. Anybody else is having any opinion, they can suggest.
Good morning, ma'am. Like Dr. Soumitra Mishra had said, I also think the main problem, like in most like hospitals, most government hospitals, especially, the problem is in many places there are no lighting. So CCTVs come next. The basic thing is there is no lighting, and this is right next. It is near our rooms, near our resident rooms, or it is right next to the corridor where we go to our wards or go to our ICUs. So many a time there is the thing is we'll have to cross those areas which are actually dark. So we might have to cross that and then go to our ICU. So we may or may not be able to completely avoid the situation. But what I would always suggest is you should go with 2 or 3 of your friends. In such unlighted areas, you should not go alone. You should go with any confident, anybody who's your best friend, whom you trust, whoever you trust in. You should go along with them in these areas which are not lighted. And one more thing is there are some construction locations in the hospital. So sometimes they are trying to renovate certain areas. So there are laborers and there are other people who are not, they don't have any ID. They don't have a specific ID, or they are not an employee of the hospital. They are just contract workers who might be coming and just coming for this particular job, whichever they'll have to do for that construction or for that renovation work. So those places, it is better for us to avoid. Like if we can, we should maximally try to avoid those areas of the hospital. So only places which we know and which we have worked in, we should uh, we should go to those areas, and we should avoid any places where renovation work is going on. So that is one thing. And there are many pathways to the same place. Like for example, we'll have to go to a canteen at night, or we might have to go for some references. There might be many shortcuts also to get to that place, maybe through different buildings. But we should always choose the roads, that is the main roads. Like within the campus, we'll have main roads also. We do have these gullies also. So many a time it is better if we choose the main roads rather than these shortcuts, just because to get our work done faster. Sometimes we might go through these small gullies, but it is always advisable to go in the main roads, so that we have other people also. They might also be going. So it is when many people are there around you, it is quite unlikely that somebody tries to misbehave with you. So this is what is my opinion.
So
And
Dr.
another
Supremi,
suggestion for all new generation that we have seen recent in the conferences that doctors themselves are out of their social barriers in the conferences. Better to avoid drinking in the conferences for the girls, because if you want to drink, you can have in person, but not in the public places, so that you can resist the people if they are crossing their limits.
Can I add something here?
Yeah, sure, ma'am.
First and foremost, never forget about your own safety. All right. So you're talking about these corridors and all that, but always carry something with you with which you can protect yourself. So pepper spray is one of the safest things that we think that we can carry and use in times of need. Because you don't know where danger is lurking and how you can possibly, manage that. So that is something you need to carry with yourself. A torch is something which you need to carry with yourself at all times. You have your lap coat and you have your pocket, so please keep that. Keep your emergency setting on your phone. I request all people in a particular hospital to have this SOS system installed in their phone itself, so that when you're going and you feel that there is some problem, you can immediately switch on the button and your people are alerted that you are in danger, and they can find your location. Always keep your location sharing on when you are going out for duty, so that we can locate you if in case that you are not contactable. Secondly, all of us have to learn self-defense now. This is a need of the hour, and every woman needs to protect herself and not depend upon a third person for her protection. Extremely, extremely important that whether your institution gets these kind of courses for you or not, please go ahead and enroll in these courses and get prepared in self-defense. Any kind of martial arts, any kind of weapon that you have. And my dog agrees with me over here, so she's also vociferously saying, all women, please do this for yourself.
So I agree with Dr. Nilima ma'am. We recently had training for women doctors and healthcare professionals in our own institute just last month. And ma'am, there's a question in the chat box from Dr. Gautam Kulkarni. Can we promote spy cameras like spy pens or keychains to the doctors, male and female doctors, which is like easy to hide in the pocket? And will that help us?
It will definitely help you to gather evidence. All right. So if you feel that you are in unsafe surroundings, nothing like it, you should have one. I don't see any reason why not to have one. The only thing is this, that when you are going and coming and you're having these spy cameras on you, that is fine. But if you're sitting with somebody, All right. And then that person has the right to know that you are recording. And the moment that person knows that you are recording, he or she will automatically stop that violent stature. So we also advise people that wherever you are having these kind of meetings, where you're declaring death, there should be mock drills for doctors for handling these situations. So how to talk to patients, how to communicate, where to communicate with this, who all to have with you when you are communicating. Don't just go out there and say, oh, your patient is whichever way. There is a way to tackle declaration of death. So these kind of drills and these kind of training has to be given, because that is a situation where violence can erupt anytime because of sentiments. It is not that the person wants to hit you or do anything, but the patients also have lost a near and dear one. They at that time are not understanding what has exactly happened. So this is a reaction to it. I'm not endorsing their reaction at all. Okay, it's not right at all. But then, yes, they have the right to grieve. They don't have the right to hit you. So how to avoid these situations is what we need to train ourselves for. Secondly, someone over here right now said that in conferences you should avoid drinking. The female should avoid drinking and all. I do not feel that that is the way things should be done. We have an equal right to do what we want to do in public. The constraint and the restraint has to come from the male people, and there have to be bouncers in these conditions. If you want to go to a conference where drinking is allowed and drinking is available, and you feel that you want to sit there and drink, all right, that is your choice. But once you've made that choice, you have to be aware of the consequences and be prepared for them. So don't drink when you are absolutely alone. Have somebody with you at all times. This is a rule anywhere and everywhere, not just medical conferences, not anywhere. Even if you go to a pub, don't go to a pub alone. All right, it's for all genders. Nowadays, even males are not spared. So let us not discriminate against our male children as well. All right, precaution is for every gender. And in this society now, I think gender discrimination should not be followed. I agree completely that the females are more prone with a heavy discrimination. I understand that. So we have to be more careful, and we have to fight for our rights. Otherwise, don't go, don't drink, sit at home. These are very backward thoughts, according to me, and should not be encouraged at all. Right? We have to
Drinking
actually themselves.
drinking is not never supported by me, because being a surgeon, I totally disagree that drinking is good for health. But still some people feels कि they should drink. मैं तो बोलती हूँ कि boys को भी drink नहीं करना है.
Agreed. We are not talking from a medical point of view, we are talking from a social point of view. All right. Samita, agreed.
But they are thinking
point
that
well taken, Dr. Nilima ma'am. I think very well said. I agree with what ma'am has said, and I think we should move forward with our next question. It is for Dr. Sharmila Sondhi ma'am. Ma'am, what precautions do you think that women doctors can practice in our healthcare surroundings?
Hello, everyone. I'm Dr. Sharmila Sondhi, Vice President and co-founder of WAI. And I'm proud to share that we have nearly 2,000 women doctors in our WhatsApp community. The WAI initiative states that everyone has the right to life, liberty, and security, and a safe and healthy work environment is a basic right. I would like to thank Dr. Gauri Saroj for giving me this opportunity to interact with women doctors on the Umang platform. A heinous crime has been committed in a hospital with a trainee woman doctor as the victim, and justice with deterrent exemplary punishment to set an example for others is the only way forward to prevent such crimes in the future. The need of the hour is a zero tolerance policy for violence against healthcare workers. We are all here today to discuss the issue because an ounce of prevention is worth a pound of cure, a fundamental principle of healthcare. Dr. Nilima has already given us many examples of how we can prevent and take precautions for violence against healthcare workers. To create safer workspaces, it is healthcare institutions should foster gender equality, implement stronger harassment prevention policies, and ensure that women are adequately represented and supported in leadership roles. A word about WAI before I proceed to the question. WAI has evolved into a very interactive networking platform for mentoring, advice, exchange of ideas, and skill development. There was an outpouring of fear, horror, anger, and outrage in our WAI group in August, with hundreds of messages sharing images of the nationwide protests and a cumulative desire to take decisive action. Doctors in our groups were feeling insecure after many years because of the incident at the workplace. And they even questioned whether they should allow their children to follow our noble profession if the security cannot be maintained at the workplace and the safety is not assured. WAI has filed a petition in the Supreme Court funded by contributions from individual members and subsequently approached the National Task Force of the Ministry of Health and Family Welfare to address safety-related issues, working conditions, and well-being of healthcare professionals with various proposals, including the establishment of special courts specifically designed to handle cases involving healthcare professionals. Now coming to the question, ensuring a safe workplace for women doctors and healthcare professionals is critical for their well-being, professional growth, and effective patient care. Comprehensive precautions need to be taken, and safety measures are essential. There are several key strategies, and the first one that I would like to say is public and private health services should have a policy in place that defines their organizational code grey response, which must align with code grey standards. Code grey protocol has become a reality in hospitals in Kerala recently. Safety audit for compliance with current code grey and code black standards to identify areas for improvement in the organizational management of responses. Sexual assault support systems should be implemented to provide structured support and resources for women experiencing harassment. Confidential reporting mechanisms with clear, easy-to-access channels should prioritize confidentiality to protect victims from retaliation. Counseling services for victims of harassment should be available on-site. Awareness campaigns, regular training, and awareness programs should be instituted with zero-tolerance policies for harassment. The mentor system is a good system where we're working, where if any woman doctor has a grievance, then she can contact the mentor in the same institution. Panic button alarms, especially for those working alone or in secluded areas. These can be in the form of personal panic alarms, which are portable devices which can be worn on a lanyard or clipped to clothing. They can be integrated panic systems, which could be connected to hospital security or local law enforcement for a rapid response, and mobile applications, which has already been mentioned by Dr. Nilima, can be used discreetly to call for help. The other enforcement is for legal redressal and anti-harassment policies. There is a lacuna in India with respect to laws. There are state laws in many states and union territories, but their implementation is weak. The proposed legislation seeking to punish people who assault doctors and other healthcare professionals with imprisonment for up to 10 years has been put in abeyance. So we need to follow and implement strict laws like in countries like Australia. There should be clear anti-harassment policies which can be communicated clearly to all employees during onboarding and through ongoing training. Legal assistance with separate special courts, giving access to legal support for women who decide to pursue legal action against perpetrators. They should be able to file complaints without fear of retaliation or negative consequences for their careers. But we then just heard from Dr. Paramita about the threat culture. So that's what happens. Internal committees with an independent person on the committee that is not related to the institution may be more useful in grievance committees and good representation of women to ensure fair and impartial investigations of harassment claims. Setting up a distress helpline, creating a platform and database for healthcare workers to lodge complaints, and conducting security audits of hospitals could be crucial steps to mitigate damages. SOPs need to be formulated and implemented by the regulatory authorities. Lone worker safety, or lone wolf cover. Many women doctors, especially those on night shifts or in isolated departments, work alone or with minimal staff. Ensuring their safety requires lone worker monitoring systems, technology-driven solutions like wearable devices or smartphone applications, which can tackle applications in real time, providing emergency alerts if the person is in distress.
Very informative.
And then a little more. I just want to. So for the lone worker monitoring systems, you can have technology-driven solutions, regular check-ins with established protocols with a supervisor or security, and a pairing or buddy system where women doctors are always paired with a colleague or security personnel during high-risk hours or while attending to high-risk patients. Security infrastructure improvement has already been mentioned, and this includes CCTV surveillance by installing cameras to deter potential attackers and ensure that incidents are recorded. On-site security personnel to de-escalate volatile situations and provide a quick response to emergencies. Secure access control. So creating a safe workplace for women doctors and healthcare professionals require a multifaceted approach, including the implementation of robust legal frameworks, personal safety tools, and proactive support systems, such as SAS and lone worker monitoring. Institutions must enforce clear anti-harassment policies, improve security infrastructure, and ensure access to legal and emotional support. By adopting these precautions and measures, hospitals and healthcare settings can then provide a safer environment where women can focus on delivering quality care without fear for their personal safety. Addressing these systemic issues can improve not only the safety of women in healthcare, but also the overall quality of healthcare delivery and patient care.
Thank you, Sharmila ma'am, for your words. Before we proceed to next question, there was a IMA survey which was conducted post this RG Kar incident. It was done by IMA Kerala, compiled by Dr. Rajiv Jayadevan, which is going to be published in October 2024 issue, where the study surveyed 3,885 doctors, in which it revealed 45% they lacked access to the duty room during the night shifts. It is all over from 22 states, where 85% were under 35 years and 61% were interns and postgraduates. Women constituted nearly 63% in this survey. Several doctors reported feeling unsafe, 24%, and very unsafe, 11.4%. Even some people thought of carrying a weapon for protection. This is going to be published sooner. And even doctors of age 20 to 30 years had the lowest sense of safety, and this group largely consists of interns and postgraduates. More than half of the instances, that is nearly 53%, duty room was located far from the ward and casualty area. This is the condition in India. So let's proceed to the further question. Legal aspects of women's safety. What are the facts and what is the reality? Practical issues, knowing the legal procedures. For Dr. Vaidya, ma'am.
All right. Thank you very much for having me here. My complete name is Dr. Lilima Vaidya Bhamre, and I am a gynecologist, mainly practicing gynecology itself. And my medical legal and legal thing comes differently, but I am a qualified LLB person. All right. Today we are talking very, very practical aspects. So women need to first know what their rights are. All right. So what are the basic rights that any woman has? These include the right to live free from violence and discrimination, to enjoy the highest attainable standard of physical and mental health, to be educated, to own property, to vote, to earn an equal wage. All right, these are our basic rights, and women are not aware they are supposed to earn the basic wage. They do not know that they cannot be discriminated against. We as women consider ourselves to be backward, and that I think is the main problem. So unless and until we consider ourselves on par with our male counterparts, we will never be able to fight for justice for ourselves. Because if you're not aware of particular things, you will never fight for it. All right. Now, the Constitution itself gives us a few rights. What does the Constitution say? Article 21 is an extremely important article for every human person, not just the women. It includes that every citizen, including women, is entitled to the right to life and dignity. Understand, right to life is a huge umbrella of rights, not just to live. It is meaning that it is the right to live a quality life, a good quality life, and with dignity. Please understand this. The Constitution has guaranteed you that. According to Article 14 to 18, that is the right to equality. Now, what does equality means? It's right to equality provides for the equal treatment of everyone before the law, prevents discrimination on various grounds, treats everybody as equals in the matters of public employment, and abolishes untouchability and titles. All right, this we have to understand, because what is equality is equally important to understand. Now, existing laws, what are the protection given to the women by our existing laws? The very first one is the Immoral Traffic Prevention Act of 1956, the Dowry Prohibition Act of 1961, the Commission of Sati Prevention Act of 1987, Protection of Women from Domestic Violence Act of 2005, Sexual Harassment of the Women at Workplace Act in 2013. This had come in place of the Vishakha guidelines when Bhavari Devi was gang raped in Rajasthan many years before that, 87 or something. Now 2013 has superseded, replaced that committee, and it is sexual harassment of women at workplace, which today is our topic for discussion. The Criminal Law Amendment Act of 2013, the IPC was amended by this law. Now everything has been replaced by BNS, BNSS and all that. The Indecent Representation of Women Prohibition Act of 1986, the Indian Penal Code of 1860, the Indian Evidence Act of 1872. All these acts, the IPC, the CRPC, and the Indian Evidence Act have now been replaced by the Bharatiya Nagrik Suraksha Samhita, called BNSS. Bharatiya Nyaya Samhita, BNSS replaces the CRPC, that is the procedural code. The Bharatiya Nyaya Samhita, that is BNS, replaces the IPC. IPC involves all the crimes that you can possibly commit. It enlists them. And the Bharatiya Saksha Adhiniyam, this is the Indian Evidence Act. This has replaced the Indian Evidence Act. So all these three 1800s में जो acts बनाए थे, ये अभी repeal होके replace हुए हैं. So now the new acts are in place. Now, why were the new acts needed? Because the BNS, the original IPC, had around 511 sections. The BNS has now got it down, consolidated it to around 358 sections. All right, so that was important. The Criminal Procedure Code had laid down procedures, but they were from British times. So the BNSS Act has now replaced this, and the codes are better procedurally, so that the cases can be solved at a faster rate. Now, what is the difference now? You have to understand what the difference has come about after the new acts have come in place. All right. So let us just enumerate them. Under the BNS Act in section 69, it penalizes consensual sexual act with a promise to marry. This was not there available in the IPC. A lot of men used to promise women that I will marry you, and they would, have sex with her. And then when they took them to court, the court would say, "Arey, this is consensual. So isme rape kahan hua?" Right. So the BNS has considered this and now criminalized that act as well. Section 86 includes the mental harm within the definition of cruelty to women. Initially, mental harm was not considered under IPC, but now, since mental health of women or mental health of a human being has become extremely important, the BNS has addressed this situation also and has included it in the definition of cruelty to women. It has excluded adultery from the criminal code. Please understand, this is beneficial to both, because right to live a quality life, right to get your needs satisfied is equally for the man as well as for the woman. And that is why the Supreme Court has given endorsement to the Supreme Court judgment of Joseph Shiney judgment, which decriminalizes the adultery part. So BNS has completely eliminated that part. Section 77 makes voyeurism gender neutral. In the IPC, voyeurism, what used to happen is that men would employ women to create these films and all. And since women had filmed them, the voyeurism, the man could not be punished, right? So now what they have done, they've made it gender neutral. So even if a woman does it, the man who asks her to do it gets punished. Section 183, the statement of victims of offences of gang rape, stalking, criminal force, sexual harassment, etc., shall be recorded by a female judicial magistrate. Only if she is not available, then a male is allowed, which was not the case in the IPC. The IPC, the magistrate could be anybody. All right. In the IPC, whom you tell your problem to, the police person had to be a female, but the magistrate was not a female. Now the BNS insists that even the magistrate be a female. All right. So this is what we need to understand. Now, practicality of the whole thing, like I said, unless and until the women themselves come forward and talk about it, because a lot of times sexual harassment, workplace harassment, rape, or molestation or everything happens sometimes besides the workplace. All this can happen at home with your known people, and your own people, your own mother or your own sister or your own aunt may say कि no बच्चा ये तो अपने फैमिली में है, इज्जत है, अपना नाम खराब हो जाएगा, आगे जाके बात मत करो, चिल्लाओ मत, and all these things. So unless and until the woman takes the stand कि no, whatever happens, I'm going to fight for my right, these criminals will never be got to book. So women have to understand that you are the pillar of your family. The way you behave in your family sets an example for your family. If at all, marital rape, by the way, the BNS has not criminalized marital rape, and that is one of the biggest drawbacks of the BNS, because I think marital rape is a very, very important aspect of every woman, because most of the domestic violence happens also in the bed. Okay, so we need to fight for this right, and a lot of women need to come forward with complaints to the police so that the law takes recognition that this is an important aspect of a woman's life, and that right to life or safety or dignity, all right, is violated in the house itself. So unless we women come out and we talk about it, this aspect will never be considered by the BNS, and this needs to be considered. The BNS has dedicated one entire chapter 5 to women and child development. All right. Now, again, why women are being clubbed with children is something I have not really understood. It is as if we don't have an independent existence. All right. Why children? You make a separate chapter for children. You make a separate chapter for women. You make a separate chapter for men. Whatever. You have made a separate chapter for human rights. Aren't children and women human rights? We aren't human. We are, right? So a separate chapter, fine. If you're giving us additional rights, if you're giving us additional protection, we accept it. No problem. Thank you very much. But why have you clubbed us with the children? Isn't the responsibility of the children the man's as well? Because it is procured by both, right? By the sperm and the egg. So these are certain drawbacks of the BNS, and women need to fight for their rights. Now, what would you possibly do? Okay, when you are having a problem and you want to go and tell somebody, where all can you go? First and foremost, any civil case, obviously into the civil court. All right. Civil case is not entertained by the police. Any criminal case, that is entertained by the police, and you should always go with somebody to the police station, register your FIR. Do not move from there. There is a concept called zero FIR. It means that even if some assault has taken place in a particular city, suppose in Mumbai, and you go from here to Jaipur, you can record that assault which happened in Mumbai, even at Jaipur, and the Jaipur police has to take cognizance of this. Many a times women face this practical problem that they go to the police station and the police just do not regard the woman at all. They do not take their complaint. They just make them sit over there and endlessly just go on making her wait, so that finally she gives up. But then you should not give up. What you should do is hire a lawyer and put a case against that police station, all right, that these people are not willing to take our FIR, and then action can be taken against that police personnel as well. All right, the law is there. You need to know it and you need to follow it to the hilt. If at all, any time you have a sexual assault happening on yourself, first and foremost is examination. Now, there are rules and regulations that are available for examination of a sexual rape victim. and she should go to the nearest possible government hospital, because that is where the facilities are available, where social workers are available, and where every care can be given to her. Not all private hospitals have this kit for examination, which we are supposed to keep with us. So please contact your local medical associations and try to get these kits made available to you, and learn the procedure of examination of a rape victim, so that we can help our own sisters, in the times of need. Follow all procedures, go complain and stick to it. Do not withdraw your complaints under pressure. Hire a good lawyer. You can also, nowadays, there are a lot of companies which are coming up which give you protection under this. All right. So you can try and get an insurance under that also, and legal protection for you. A person who cannot afford it, the legal cell is available, which is free of charge for you. At any court that you go and you say that you cannot afford to hire a lawyer, they will supply you with a lawyer, because that is one of your basic rights. So do not think that you are alone. Try and since we are all doctors over here, your medical associations are also there to help you. So approach these people, try to get help, and lodge complaints and persist till the end. If you withdraw your complaint, then it will be like a fallback, it will be a setback for us, and less and less number of women will come forward. And stand strongly. That is why I think Somita had started this entire mission, and we hope to take this case forward, but only and only if every one of us come together, form that association for ourselves to fight for our rights. And it is my request to all of you again, to please join in and help us wherever you possibly can. Are there any questions for me? Because I've hurried through the entire thing. We had just 1 hour today. So legal aspects, I have told you. What you're supposed to do, I have told you. All right. And
One question from the resident side.
tell me.
Since all are residents and there are some people who are not physically torturing, but their eye contact and their way of seeing someone is like not good. So as in that aspect, what we should do? Should
See,
because
basically,
it's not like we cannot have any proof कि हाँ उसका आँख नजर खराब है या कुछ है, but the way they talk, the way they see, we don't like.
okay. The way of tackling this, first and foremost, is that law is based on evidence. All right. So you have to record it in some possible way. And I do not think today that technology is lacking where we cannot possibly record these instances, because a man will not make, a man or anybody senior will not make eyes at you at one instance, right? It is multiple times that this is happening. Next time, go prepared. Record it. All right. Once you have a recorded evidence, then you can go ahead and do it. If at all you don't have a recorded evidence also, all right, there are ways where you can tackle this. You can, internal complaints committee is supposed to be established in every hospital, or where the minimum of 10 employees are there. They need to have this kind of committee. You can go and report this incident within 30 days of 30 or 90, I'm not very sure. But you can go and report this incidents, and then action can be taken against that. Also,
90 days.
90 days, yeah, 90 days. We request all of you to see to it that these committees are established. The internal complaints committee. Vishaka committee was only for sexual harassment. Internal complaints committee also can take up, because this is a kind of an harassment only, right? So internal complaints committee can take it up, give it to them in writing, write an email, have your email IDs ready, so that you know where to complain, because sometimes written paper, they will say, oh, it got lost, we don't know, we don't have a record and all that. So always go in duplicate, have a Xerox paper, take a duplicate, go over there, get a received signature and stamp on it, and keep a copy with you, so that you have evidence that you have complained against it. And keep gathering these kind of evidences. And the entire residents people, it is not you alone over there, it's a resident body. The entire body, the MARD also will be there in your hospital, or the neighboring hospitals, or the teaching institutes. You can approach them, and I'm very sure the MARD is very proactive, and they will definitely help you. Naming and shaming always works. All right. Naming and shaming has never lost its quality, has never lost its flavor. All right. So name the people, shame them in front. When this thing is happening, slap them hard. All right. You have a right to protect yourselves, and that will shame that
And they
person.
are
for not doing
HOD or they are who will pass our exam. Nobody will take such initiative.
मैम ऐसा है, अगर आप खुद के लिए नहीं लड़ोगे तो कोई दूसरा आपके लिए लड़ने वाला है नहीं. सो यू हैव टू डिसाइड. ऑलराइट, दिस हैपेंड विथ मी आल्सो. ऑलराइट, एंड सी ऐसा होता है, हाउ यू टैकल इट. फर्स्ट टाइम साम दाम दंड भेद, बरोबर आहे. पहिल्यांदा ट्राय साम, देन ट्राय दाम, डज नॉट वर्क, राइट. दैट मीन्स ही नीड्स टू बी पनिश्ड. नो, यू आर बॉदर्ड अबाउट योर एग्जाम, यू विल पास. वो कितने दिन रहने वाला है. All right, don't get bowed down by all these things. Okay, they can maximally, what happens, see, I'll tell you one incident in my school. All right, I did not participate in our school competition. I'm very sorry, just take 2 minutes. All right, and my principal said that I will take away all your internal marks. I did not bow down to her. I said, ma'am, 30 marks होते हैं, आप सारे ले लो, बचे हुए 70 marks मैं लेके आऊंगी. All right, and I got 100% on those 70. कौन फेल करेगा मुझे? You may not get good marks. I agree, you may not get good marks, but who's bothered about your marks once you're in practice, right? How good a doctor you are, that is important. Okay, and I don't think a person who's been named and shamed, all right, can actually do that to you. He will be more aware. You warn him, no, instead, if at all I fail in this exam, तो मैं तुमको देख लूंगी. Okay?
Nilima, hi. Sandhya here. Hi.
Hi, Sandhya.
Hi. At this point, now, I just want what you're saying is absolutely right. We've all been together. We've all stood up for our rights. But students sometimes they get very worried. They come from different states. That if I don't clear my MD, my thesis doesn't get passed. So I think one recourse is that they can collectively take a signature campaign. I remember once we had done it against a professor, and we had brought it to the notice of the management, and it was collective. So what happens is one person doesn't have to face if you're scared, that is.
Fabulous. I just said that you are not just a single person over there, you are a resident body. All right. So this is a fabulous suggestion by Sandhya, and I think we should take it up. Why not?
It's like together we stand, divided we fall.
Yes.
Absolutely. Absolutely. लेकिन प्रॉब्लम कहाँ पे होता है ना, जिसके साथ ये होता है वो चुप बैठता है, वहां सारा इशू खड़ा होता है.
वो तो चुप नहीं बैठता, दूसरा लोग चमचागिरी के चक्कर में उसको सपोर्ट नहीं करते. एक्चुअली वो सी भी एक इशू होता है, बिकॉज जिसने सफर नहीं किया है ना, वो सोचता है कि मेरा काम तो चल ही रहा है.
देखो सौमिता, ऐसा है कि वी हैव टू बी प्रिपेयर्ड. अभी एएनसी में 90 महीने में पेशेंट डिलीवर होने वाली है, तो हम क्या जब वो डिलीवरी को आएंगे तब कॉम्प्लिकेशन बताएंगे उसको? नहीं ना. वी हैव दीज 9 months टू प्रिपेयर हर, राइट. दैट इज व्हाई वी डू एएनसी कंसल्टेशंस. I personally also feel that you should not wait for this to happen. You have to have unity amongst yourselves. All right, that you develop, na, create a band. Why are the seniors feeling that they can break you up? That is your job. You create your own security systems. अभी फाइट ही करना है अपने इंटरनल में, तो फिर भुगतो, क्या करेंगे?
वही हो रहा है मैम. मतलब I am an institute where I am the only 2 residents are there and we don't have any majority. Basically DRNB and DNB is like isolated person. They have to take their own initiative and I am taking that. But some of my friends who were doing MCH and they have in good colleges, उनको कुछ issues थे, तो मैंने कहा आपसे better reply कौन दे सकता है. Because in there, like,
personal issues are very difficult to solve, all right, unless and until we know and we talk one-to-one and know the situation and how we can, catch that particular person. It is very difficult to talk on a platform like this, all right. So precautions is the first thing that you are possibly going to do, all right. Record, get evidences, create a band. Sandhya has given a very good idea about signature campaign. I think it should work. All right. See, a lot of times, we are talking only about the seniors trying to do this to us, but I have seen women, okay, juniors who also suck up to these seniors and want to give them favors, in return of favors. All right. So it happens both ways. Let us not hide our the thing behind this. Yes, I agree. Seniors are in a position of power, and that is why they should not misuse that power. That is a different thing. All right. I offer you something, but you are in the position of power. You have to refuse me. Right. So it is that way. It works both ways.
It is a sense of sisterhood that should be inoculated during the training days only, where the women should be looking out for each other rather than competing and harassing another women.
True.
The women should look after each other women.
Absolutely. There is nothing like a sisterhood, and you should be open in that group, about very clearly you have to talk, and all of you together have to stand up against these people. Otherwise, it is very difficult. And gather evidences. It is not difficult to gather evidences, by the way.
So, thank you, Nilima ma'am. I think you have very wonderfully summarized the gist of all our acts, the legal aspects, what are our rights as women, what we should know, how we should exercise those rights very wonderfully, ma'am. I think true that you are a medical legal expert, and we should definitely follow what you have said.
And we
To
are
throw
very lucky
some
to have you.
Thank you.
Yes. To throw some light on National Task Force, I would like to say a few lines. A National Task Force has been formed to address the systemic issues regarding the lack of safety for medical professionals by the Supreme Court on August 20. And the National Task Force will prepare an action plan under the heads preventing violence, including gender-based violence against medical professionals, providing a national protocol for dignified and safe working conditions for all the medical professionals, including the Can you hear me? I think there's some disturbance. I request everybody to mute their mics, please. Okay. So the National Task Force will be providing a national protocol for dignified and safe working conditions for interns, residents, senior residents, doctors, and all the medical professionals. And it also includes the Employee Safety Committee that comprises of all the medical professionals. So I think we shall go for the next question. Our next question will be to our resident doctors. Next question will be to our resident doctors.
Your voice is echoing, Sharbari.
Okay.
Your voice is echoing, Sharbari.
Okay. Am I audible right now? Okay. Should I? I'll just.
So the next question is, how do we all women remain united all over India in a situation like this?
Soumyata.
Actually, what I tried after this incident, it's like just after seeing the 15th August night, it was a horrible incident. So what's my plan is to get together, whatever we make one Women Doctors Association for India, in which we will try to get one good oriented, or what to say, one brave doctor from your hospital, from each and every hospital, either at corporate or PSC or CSC or a government medical college, we will get a lot. So there should be one person where everybody can say ki, I am facing this problem. So, and every resident doctors of each and every hospital, they should write one letter to the authority for providing basic facilities like washroom, proper duty doctor's room. This should be written by each and every resident to their dean or their medical superintendent, so that you have to write. Rest all, if they are not doing, or if they are not concerning or not doing that, then we can say ki, they are not providing. But it's from our side, one initiative should be there. Each and every hospital, if you are not having basic facilities, please write one letter to the authority. Kindly provide us one separate washroom and separate duty doctor's room. And from each and every, because after this incident, we have already seen 7,000 doctors all united in 5 days in a WhatsApp group. It's like a miracle. So we can do such things. We can get united because all are busy, all are working. So ऐसा तो नहीं होगा कि यहाँ पे कुछ problem है. We cannot go Bengal. We cannot go any other state, but we can take care of our own hospital. At least if we can do that, I think problem can be minimized to half. Anything else? This is from my side. That's why I am main target to make Women Doctor Association, so that each and every hospital, there should be one female and one good, important, or some brave doctor who can take action for yourself. Yes, this facility should be there in our hospital. Our residents should not face this, and we can do that, I think, because every person in every hospital, they have good position. In everywhere there are female doctors which are in professor position or associate professor position. They have good importance in their hospital. At least hospital वाले उनकी तो सुनेंगे, किसी और की सुने चाहे नहीं सुने. So my one suggestion to all juniors or residents, please write one letter to your authority, dean or MS, ki please provide us basic facilities, and there should be one good consultant should be there जो तुम लोग को help करेगा, definitely करेगा, because after this incident everybody is very alert and everybody wants to help everyone. Thank you.
And one more to add on, whoever employees are working in the hospital, there should be a thorough background check by the professional agency in view of any criminal record or any disciplinary actions or any substance abuse. This is very important because many people just walk in and go in a government setup. So there should be number of trained security personnel and CCTV cameras and proper lighting, like how she said, proper lighting is very important in such conditions.
Actually, already I have raised 30 pointers, which I have already circulated in our groups. I had made one Women Doctor Association group, might be you people be knowing. In that, from all states, we gathered 7,000 people. And in that, we have collected 30 to 33 pointers, which approximately covering all the pointers, which I have already forwarded indirectly to National Task Force Committee. So I think we will get some great help, but I don't know when it will be implemented और कितना साल लगेगा उसको बनने में और implement होने में. तो उससे पहले you should take your own decisions and you have to take your own implementation. Don't wait for National Task Force बनेगा तभी implement होगा. अभी हमें क्या करना है वो हमको सोचना है.
Now we can see the protest in Arjikar, despite of all troubles, they are standing strong for justice is really very commendable. It is like a huge example for this. Together we stand and divided we fall. Today is day 49. Still justice is not served. Hope justice will be served soon.
So my question to Dr. Sukanya, Dr. Soumyata, and all the residents, like, how do women all over India remain united? What is your call on this? I mean, what should we do as women to be in this together? What are the measures that you think, new ideas that we can implement? Is Dr. Sukanya there?
Good evening, ma'am. Like, the main thing is to put all our ego apart. Like, many a time, it so happens that maybe maybe a woman is not helping another woman. So the whole thing is we should have that empathy, and we should like step into the shoes of an other person, so and understand what their concerns are. So, and one more thing is, it is not about just uniting all the women all over India. The thing is, we should also have men also should be present, and we should be able to voice it out in the front of men. Many a time what happens is we have some sort of social stigma where we feel little delicate to voice out anything, like even let us say like issues like menstruation, menstrual hygiene. Maybe we don't have dustbins everywhere, we're not able to voice it out in front of men. There are many women who feel delicate or don't find it easy to tell their problems out. So what I think is, since we are all mature adults, so we are not kids anymore, I think even the opposite gender would understand. So the thing is, as women, we should be able to voice out even in the front of men. So in each department, if we are facing any problem, there should be a grievance cell where where with us, our HOD and other professors, we should be able to have these meetings, like maybe once every 2 or 3 months, like we should be able to list out our problems, maybe the certain problems which we are specifically facing in a department, and we should be able to like list it out and put it out on an open platform, rather than keeping it to ourselves, so that we will also get support. And we should be able to confide. We should have some one or two friends in whom we can confide, so that they will support us in times of need. And even as an institution, I think they should have a grievance cell. Till now we don't have that, like in any institution. So we are not like able to, so if you have a grievance cell, there will be specific people who will take this up. Otherwise it just goes blind. We are not able to meet the heads of the institution because they are busy, and many a time we are not able to meet up with the people who are in charge, like for example, dean or principal or vice chancellor. The thing is, we by the time we get to meet up with them and to voice out our concerns, the thing is we have to first get an audience. So for that we might have to meet up with the secretaries, and maybe it gets delayed. Whatever we want to voice out, maybe we don't get immediate action for that. It gets delayed by 2 weeks, 3 weeks by the time that we get audience with them. So what I think is there should be a separate grievance cell who can take this up, so that we get some immediate, so that we can voice it out immediately, and after that it can be passed down to the heads also, so that maybe the action would be faster. I'm not sure how far this will work, but at least I think we can try this out in institutions.
Yeah, I think very well put, Dr. Sukanya. I mean, the way you have told about the grievance issue and how it should work, I think we are all in this together. The women and the men, they should equally be taught about their rights, about women's safety, especially the men should be taught. Boys should be raised well. I think that is how, that is the root issue. I think we should have some concluding remarks from all our faculties. If you would like to conclude this, we are actually running out of time right now. Yeah, I will start with Dr. Nilima, ma'am. If you could say one sentence to summarize this whole women's safety forum, what is your one advice that you would like to give?
Charity.
Connection lost, ma'am.
So she thought about Article 21, and she thought about zero FIR, where we can file a case anywhere, any part of India. And she said about legal protections, what all to be done immediately in the acute, hyper acute situations. So that was very good, very informative. We were not knowing about this at all. And it's more of saver and safer. It's time to teach good touch and bad touch and not to touch.
Not to touch is very important.
Yeah, so Dr. Soumyata, would you like to conclude?
For my side, it's like I am started a motive to be here because the first day I thought after 15th August that we need our Female Doctors Association of India. That is very important because IMA and every associations are there. They all are male dominant and our voice is suppressed. So it's if all good, brave women are coming up, then we can do that. We can help ourselves. Why we need so much? ठीक है, males are important because not every male is bad. That I can understand. सब खराब नहीं है, पर कौन अच्छा है, कौन खराब है? And all good persons might be busy in their own work. I have many good teachers which are teaching me surgery, and they are very busy in their surgical part and they have no time to do social work. Okay, so good people are busy in some way other things and bad people are busy in some other things. So now it's high time we too have to fight for ourselves. So please come forward and join us. We will have some good association and we can do work for our hospital and our state at least. Thank you.
Thank you, Dr. Soumyata. Dr. Sukanya, would you like to say something? Dr. Sharmila, ma'am.
Yes, I would like to say that we at WAI with Dr. Kalpana Nagpal as the president, and I'm the co-founder and vice president. We have achieved a lot. It was a dream for us to get a platform, and we have this with nearly 2,000 women ENT surgeons on in our WhatsApp community. So it was the combined effort of all the doctors and their feelings that resulted in us taking very decisive action and filing a petition and giving a letter with our recommendations to the National Task Force. I believe in that there is power in numbers, and we should utilize this power of numbers to get maximum documentation, like whether it's from the resident side or from the faculty. All women who are involved in safety should document in some way, whether it is starting from their institution and then to whatever state level organization, doctors organizations, and at the national level, the National Task Force. So when you have the power of numbers with so many people reaching out and documenting, like Dr. Nilima said, you have to have some evidence. So when we have a wonderful session today, and if all those who are watching and all those who will listen to the YouTube channel, they also work individually to represent and ask for action to be taken at every level in the hierarchy, then we will get change. And that is the only way to get change.
Ma'am, very thankful to you because your association is very important at that present time. I was not aware that there is any such kind of association. Actually, there are many Foxies and many women doctor associations are there, but nobody has to take any stand for Abhaya. So I was very happy that already there is one good association of ENT doctors, and in future I would like to collaborate with you so that we can have some good women doctors association. Being I am a surgical oncology resident third year, so I am thinking this will be a good initiative. Thank you.
Definitely. And also I would like to mention that we have also contacted a lawyer who is ready to give advice to our members if they face any situations. So a legal cell also is very important. And definitely I would like to collaborate and expand whatever we have already.
Yeah, ma'am, because it's very need of our, because you are ENT, I think, but if all women would have combined, better impact can be there.
Definitely, the numbers are, the more the numbers, the more the impact. No doubt about that.
Few words from Nilima ma'am. She said charity begins at home. We need to make the males in our households more empathetic and supportive to our cause. Teach our children to respect all genders and empower our men to handle empowered women.
That's very right.
So, audiences, any questions to be asked to the panelist?
I think we have a lot of appreciation from the audience that it was a very, very good session, very informative. People are very much getting aware. The expert panelists that we have today, Dr. Soumyata, Dr. Sukanya, Dr. Paramita, Nilima Vaidya ma'am, Sharmila Sundhi ma'am, I think we are very thankful for the insights that you have shared with us. Thank you for leading such an important discussion and throwing light on it. And I think we really appreciate the efforts that you have made in highlighting the challenges that we as women healthcare professionals face and what are the measures actually to take. You have highlighted it very well. So I think Dr. Divya, you can conclude the session today.
So the safety points is the workshop for women regarding the self-defense, the security personnel to be increased, and to have a buddy system during the night duties. And when the women is not feeling safe out of the hours, the open discussion should be done rather dismissing it. Then system of mentoring or supervision should be there. A living conditions should be improved altogether. Then implement Central Protection Act to prohibit violence in all healthcare settings. Even transportation facilities can be given to medical professionals from 10 p.m. to 6 a.m. out of the hours. Helpline emergencies for medical professionals should be given. And even baggage screening should be done to prevent any arms entering into the hospital, to prevent court purple. Crowd management should be done, ensure adequate staffing and effective crowd control in patient care areas. And basically, a sense of sisterhood should be inoculated during the training so that every woman look after the other women rather than competing and harassing. That we are in this together, whether it's an admin, nurse, or a doctor.
Thank you, Gauri ma'am, for inviting us. And she joined us to be a part of this group. We were not aware such type of group is run by you people. So very thank you.
Thank you, Somita. Thank you. Shruti, you had a question. You had raised your hand. You want to say something?
Good evening. And, thank you so much for the session.
Your voice is breaking.
Shruti, you're not audible.
Okay, I'll try some other way.
You can put it in the chat box, whatever. Anyone else wants to say anything, suggest besides the question? You're welcome. This is an open forum.
Yeah, I would love to share. I would love to congratulate the entire team Umang for organizing this wonderful session. I was listening to each and every word said by you very carefully, and I loved the concept, learned a lot. What I feel is, we all have an asset of a lot of information, knowledge and education, experiences that we have collected in our medical career till now, be it a student, medical student, or resident doctor, or a senior consultant, or a head of the department. We should use our power of expression the way Dr. Saumita was expressing, the way Dr. Nilima was expressing, the way Dr. Sondi was expressing. This is a group of, say, 30-35 people join. We should voice it out more on a bigger platform like LinkedIn, bigger platform like other social media platforms. So ये और ज़्यादा audience तक जाना चाहिए, and we should also focus on a lot of, you talked about what we should do once the assault or the attack happens, or the medical legal aspect. We should also focus on building the harmonious relationship amongst ourselves, amongst the hospital team, college team. So, होने के बाद क्या करना है उस पे तुमने बहुत
Our
बात
main focus is there कि we should avoid such situation.
Yes. So we should also, the leadership. Every college, if the leader, the dean takes the responsibility, the head of the department takes the responsibility. Yes, I take the entire responsibility of my department, there we should work on. The leader should also work on the building harmonious relationship amongst the entire team, the team of residents, be it male or female. Because many male doctors, they protect us, they're good human beings. There are very few perverts, and because of them, the entire fraternity is disturbed. RG Kar ka hi dekh lijiye. We have such a prestigious legacy of RG Kar. Dr. Radha Govind Kar is the founder of that hospital. Such a prestigious legacy of that hospital is ruined by such bad people. वहाँ पे काम होना चाहिए, हार्मनी पे काम होना चाहिए.
एक्चुअली प्रॉब्लम है कि पीपल जो इतना पावरफुल व्यक्ति है ना, लोग वॉइस उठाएंगे तो भी कैसे उठाएंगे. The Abhya was the one who was, I think, we are listening ki she is about to whistleblower and she was about to say something, and this heinous act took place. But thing is ki against that powerful person, a resident can raise voice. It's very difficult. So for such kind of people, I think a strong consultant over that hospital can take some resident can go and say, madam, ये problem है, madam ऐसा हो रहा है, what should I do? तो मैडम के पास इतना पता होगा कि इस बंदे से पंगा लेना भी है कि नहीं लेना है. और अगर लेना है तो भैया यू आर अ रेसिडेंट, यू डू योर वर्क, आई विल सी क्या कर सकते हैं।
राइट।
तो ऐसे अगर हर हॉस्पिटल में एक मैडम होगी या सर रहेंगे, मतलब सर से वो कितना पर्सनल लेवल पे जाके बात कर पाएगी, अपनी पर्सनल प्रॉब्लम्स कुछ बोल पाएगी, नहीं बोल पाएगी, आई डोंट नो। पीपल फील कंफर्टेबल विद फीमेल्स इफ ऐसा कुछ रहता है तो।
True, true,
तो
true. So, Dr. Samita, we will be happy to, support you and take your voice to majority. I have a very big community online. करीब करीब 25,000 का मेरा फॉलोअर्स है लिंक्डइन पे, और पूरे मतलब लिंक्डइन पे 16,000 है, और अदर सोशल. सो वी वुड लव टू सपोर्ट यू. टेल अस व्हाट, बट योर वॉइस शुड रीच आउट टू मेजोरिटी. आपकी आवाज, मतलब यूज द power of your voice. That is what everybody, not just Saumita, everybody, we should use the power of our expression. ज्यादा से ज्यादा हमने हमारी वॉइस को यूज करना चाहिए. जो भी हम लोग प्रमोट करना चाहते हैं, हमारे थॉट्स लेकर, we have a big asset of the experience that we have. We should use that power more and more.
I wanted to add something, if that's okay. I'm also a resident of surgical oncology. Because since we were discussing about RG-Kar and how we should try to avoid such a situation, I just wanted to point out to, I think everyone's come across this in their WhatsApp groups. There are news reports from 2007. So we are sitting in 24. So let's just calculate about 15 to 17 years, meaning about more than a decade, almost 2 decades worth of news reports available against this particular principle, with multiple whistleblowers, possibly not proven, undergoing, say, like dying under very mysterious circumstances. So I just want to point out to what level the rot, so to speak, and the corruption, as well as the silence, or maybe more of what do you say, silencing was going on in that college. And of course, not to defame a particular college. I'm just saying, if you take that as an index or an example for us to sort of work with, because if anything, all the women here, or if let's take the example of the WhatsApp group that has been created, everyone's shaken at core at the fact that something like this could even be done internally, let alone say, okay, of course, rape and getting sexually harassed at workplace and all this are our troubles. It is the internal rot which has come out actually. So we as women doctors, if anything, as we are saying, we should prevent this, is we should at least be able to prevent it amongst ourselves. At large, at society, yes, of course, it's a bigger work. It's something we all have to aim at. But something we have to do is, because I was actually, truthfully, I'm sitting right next to Samvita. So I was actually giving her an example of somebody I know who is at high power, who continues to be able to do whatever he does. It could be a bad glance, a bad touch, many things, lewd comments. And as surgeons, I'm truthfully telling you, our entire residency programs or our training programs are filled with it. I cannot, just like how you say, you cannot meet a woman who has not undergone some form of sexual harassment or a lewd comment or a gesture or a touch or something in the bus or etc. in public at large in India. The same way, I don't think a single surgery resident in the whole of India will be able to tell that, oh, okay, I have always had male counterparts, seniors, or anybody around them, who are clean. Everyone, 100%. No, it's always everybody. So, of course, it's not all men, but it is happening with all women doctors. I gave the example of surgery because, again, it is a male sort of driven or male filled, department, with us women still at large minority. But of course, this has happened to a chest medicine physician, upcoming physician, or resident doctor, sadly. But I'm just saying that it is still a man's world, and it is difficult for us as women to continue to practice or continue to have, as you said, ma'am, very rightly, the right to life, a good quality of life, a good quality of career, everything, promotions, etc., etc., when there are such men at power. So if they can go on for 17 years in a college as prestigious as RJ, we have to, at this juncture, do something about it. It is the urgent need to do it at every college level, at every hospital level, wherever it is happening. Said, circumstances should not happen again, where, say, a whistleblower internally has to undergo this, or That's what I mean. Of course, it's left to the CBI or the police to prove that it was internal, but we all know in the fraternity what all was going on with all the news reports and what everything, the information available out there. So that is the sad part. The information was always there. It was news reports which are out there, and nobody did anything. There are people dying in weird circumstances if you read those news reports. Because, like, just like Samita went through this entire process of bringing all of us together because of that jolt she felt and she continues to feel of how how easily it could have been any of us residents. It could have been any of us. So the same way when I felt that and I went through all of those news reports, and it is terrible. You don't want to read a single news report of those, what happened with those people. So it's scary, it's frightening, but at the same time, it is extremely, what do you say? No, it angers me to the fact that, like, this has been going on and it continues to go on. So in our generation or in our so-called careers or in our lifetime, if we can do something about it, we have to do it. So at large, it is a problem within the community is something that this association can bring a stop to, or at least a fear amongst, the perpetrators, both male and women, male and female. There are women doctors, women people at power still supporting such things too. As ma'am, I think, pointed out how people are offering said whatever, you know, offers to their respective counterparts or seniors. So these things have to be addressed very urgently because these are situations we come across every day. Lewd comments, gestures, touch. What do you do about all of this? And that's why it's an urgent need to come up with something where it does not repeat, at least in such sad and, difficult ways. Just wanted to add that. I'm sorry to take up the time. I think you were all rounding off, but yeah, thank you.
It's okay. It's a delightful, but it's very horrible to hear such things happening with y'all. The basic is raise the boys to be the protectors and not the predators. The
Actually, in
fundamentally,
Maharashtra, I did my residency. There is not such an environment, but when you come to north side and she's from south, who is the person was speaking, so they face many issues. Even I face many issues. That's why I am pursuing surgical oncology, so that I should not face the humiliation that general surgeon give to a female surgeon in north side, because they don't consider female as a surgeon only, I think. So I did my DNB general surgery from Mumbai, Somaya. So at that place, there was no discrimination between female and male. And I was not at all having that problem in Mumbai. But after passing from that, I faced many such situations, which is a different chapter. That's why we will make one Women Doctors Association and we will try to divide in different wings of department, so that every department has their own issues. Surgeons have their separate issues, medicine people have their own issues. So we can address them separately, and we will divide zones as a states and all, so that every state has their separate issues. So all women can be come together and tackle them independently.
thank you for leading us such an important discussion on the safety of women doctors. Your insights and dedication to this issue are truly commendable. I appreciate your efforts in highlighting the challenges faced by women doctors. Your moderation brought critical awareness in this vital topic. So, time to teach good touch, bad touch, and not to touch.